Bridging the gap. Depending on when you retire, you may need to find a private health insurance policy to cover the gap until you reach Medicare at age 65. According to recent data, the average retirement age in the US is 62, and this average age has remained the same for the last decade. Since most are not eligible for Medicare until turning age 65, the average retiree in America has 3 years between retirement and being eligible to sign up for Medicare. Now that we know this gap may exist, what can you do? There are different ways and combinations to cover the gap until you're eligible for Medicare. Today we will discuss how and when to use a health savings account, group retiree coverage, COBRA, and/or individual coverage via a health insurance exchange. To contribute to an HSA, you must be enrolled in a high deductible health plan and not be claimed as a dependent on someone else's tax return. While HSAs are designed for healthcare expenses, their true potential shines when they're also used as a retirement savings tool. If you have a current HSA or plan to utilize an HSA, consider letting the funds grow within your HSA while using cash flow to cover your medical expenses prior to retirement. By keeping the funds within your HSA, you can take advantage of additional tax-deferred growth. Contributions to HSAs are made pre-tax, which directly reduces your taxable income. These funds aren't taxed when they're in the HSA or when they're withdrawn for qualified medical expenses, providing a triple tax advantage. And you own the HSA, not your employer. The HSA is yours to keep for life. You could also consider using your HSA to have additional flexibility in retirement. HSA funds can be withdrawn tax-free at any time for qualified medical expenses, or if you wait until age 65, funds can be withdrawn to cover non-medical retirement expenses without penalty. If you use the funds for non-medical expenses after age 65, the funds will still be subject to income tax, but again, would be penalty-free. Some of you may have access to group retiree coverage. Some employers or unions continue to offer healthcare coverage to employees even after they retire. Typically, it's the same plan you had pre-retirement, and employers may contribute to cover premiums. If you're lucky enough to have access to group retiree coverage, it's usually the easiest and most cost-effective way to go. However, it's important to note that while this sounds like a great option, it may not be an option at all. Not all employers offer retiree coverage, so you'll need to check with your benefits professional to make sure this is available to you before you rely on it. The Consolidated Omnibus Budget Reconciliation Act, or COBRA, gives workers and their families the right to keep their employer's group health plan after insurance coverage would generally end. This temporary medical insurance can be an option for those who are forced into early retirement, face an unexpected job loss, or have a death in an immediate one's family. A potential downside to this form of coverage is that you'll likely see a significant spike in premiums, as you would be required to pay the entire premium, which could be up to 102% of the plan's cost. This option may make sense for those who really like their current plan or want to keep specific in-network providers and couldn't find a comparable option on the exchange. It is also possible that COBRA may not be available to you. If you work with a small employer, for this discussion, COBRA considers this to mean less than 20 employees. It may not be an available option. Also keep in mind that COBRA insurance is only guaranteed for 18 months, and in some cases up to 36 months. Even if you utilize COBRA coverage, there could be remaining gaps from when COBRA ends and Medicare availability begins at age 65. The last option we'll cover today is individual coverage. Under the Affordable Care Act, regardless of pre-existing conditions, anyone can purchase a policy from the state, or if your state doesn't have its own exchange, the federal health insurance marketplace, where you can comparison shop health insurance. The options available and premiums will depend on where you live, and which level of coverage you choose, the cost of which may approach or even exceed $800 per month per person. But depending on the cost of insurance, you may qualify for financial help in the form of tax credits. In 2023 through 2025, there is no income cap to qualify for tax credits towards private health plans as long as the cost of a mid-level silver plan premium exceeds 8.5% of your modified adjusted gross income. If you're considering this route, it's well worth it to plan ahead. If you have the flexibility, consider aiming for reduced income during the years in which you're enrolled in the exchange for lower premium costs.